Welcome, brothers and sisters, to your wellspring of knowledge. Remember that knowledge never be toxic to brain, but public serving and saving oriented. Let medicine and health be globally accessible. The topic of today is nausea and vomiting. Yeah, the topic of today is nausea and vomiting. Hello, friends. I am Joseph Ndaishimiye. Throughout this presentation, I'm going to share with you some of the knowledge about nausea and vomiting. Yeah, if you say nausea and vomiting, it's a very large topic that we cannot cover in the limited time we have. That the reason behind dispatching this topic into two parts, it means that I have tried all my best to divide it into two parties. Part 1, which is the topic of today, is general introduction to nausea and vomiting. Part 2, we'll be talking on postoperative nausea and vomiting and its pharmacological treatment. Friends, do you know how much important for us to have a sounding knowledge about nausea and vomiting as the problem we usually face throughout perioperative period? It's important. Please stay with me so that you can learn together. Yeah, in part 1, we are going to see the introduction to nausea and vomiting. The second uh, point, we make a little bit on neurotransmitters that involve in nausea and vomiting. We have also vomiting centers. To have a vomiting, there are some regions that must be stimulated so that you can have the actual act of vomiting. After we look on vomiting triggers. Yeah, friends, what do you understand if you say that someone is nauseated or someone is having nausea? Nausea, it's all about noxious and unpleasant recognition of desire to throw up. That's one. Second, we can define it also as conscious recognition of subconscious excitation of areas in medulla that are associated with vomiting reflex. This sensation is usually associated with some signs and symptoms. Among those we have cold sweat, pallor, salivation, loss of gastric tone, duodenal contraction, reflux of intestinal contents into stomach. And this phase always precedes or comes before vomiting. Please don't be confused. To have a vomiting, it's not always to have nausea. You can have a vomiting without having nausea. The same as you can have nausea but not having vomiting. Friends, yeah, it's very crucial to know the relationship, physiological relationship between nausea and salivation. When you are nauseated, of course, you are unpleasant, you are uncomfortable, you are not in a good situation at all. But that does not make nausea something good in something bad in total. Why? When you are nauseated, you have overproduction of saliva. Remember, in saliva we have many things, but let us talk on what we call bicarbonate. When you have overproduction of saliva, you are increasing the concentration of or the amount of bicarbonate in that saliva. That bicarbonate, remember, it's a buffer. It comes and coats the mouth and the esophageal lining, so that once vomiting occurs, the acidic nature of that stomach content is not going to damage your esophageal lining and mouth too. Yeah. Therefore, nausea, it's not something bad at all. We have seen how to increase the amount of bicarbonate, and bicarbonate it neutralizes the acidic contents once the act of vomitus occurs. Fine. Second, it's what we call vomiting emesis. We have seen that nausea, it's a noxious and pleasant sensation of desire to vomit. Now, vomiting or emesis, it's all about completion of that desire to throw up. It's also a forceful exclusion of gastric gastrointestinal tract contents, especially stomach and intestine, to outside environment via esophagus and mouth. Friends, between nausea and vomiting, there is another phase called retching, where there is strong involuntary effort to vomit. And during this phase, the abdominal muscle and the respiratory muscles, the diaphragm, are stimulated. Once stimulated, but to the level of not having vomitus out until the pressure in the stomach exceeds the thoracic pressure, to mean that you have the involuntary movements of those muscles, respiratory and abdominal muscles, but on the level of not having vomitus out. It's what you call retching. Friends, we have said that there are a number of neurotransmitters that involve in the transmission of those sensory noxious impulses, so to have vomiting. First region we have is Integrative Vomiting Center, IAVC. In the Integrative Vomiting Center, we have histamine 1, mu, and the M1, M3 receptors for acetylcholine. In chemoreceptor trigazone, we have the dopamine 2, histamine 1, muscarinic 3 cannabinoid receptors, sigma neurokinin 1 receptor 5-hydroxytryptamine, through which is serotonin. In the vestibular system, we have histamine 1 and the muscarinic 3 receptors. In the gastrointestinal tract, there is what we call serotonin, which is 5-hydroxytryptamine 3. Friends, we have the centers. We have seen that we have the neurotransmitters, chemicals that relay those noxious stimulus to central nervous system. But we have also the vomiting center. What is the center that needs to be stimulated so to have the vomiting reflex? Friends, as aforementioned, there are centers that must receive sensory signals from different body sources so to have vomiting reflex. One is the chemoreceptor trigger zone or area postrema. Second, it's what we call integrative vomiting center. Third is a special nucleus called nucleus tractus solitarius, NTS. Friends, you cannot understand the physiology of nausea and vomiting once you don't have the basics of neuroanatomy. As you know, in all vertebrates, example human, there is a complex group of brain, spinal cord, and nerves, where those nerves extend throughout the body. And this network is what we call nervous system. In the nervous system, we have two divisions: central nervous system, CNS, peripheral nervous system, which is the set of bundles of neurons that carry signals to and from central nervous system. It's what we call peripheral nervous system. In the peripheral nervous system, we have sensory and the motor nerves. Sensory, they take those electrical impulses to central nervous system, while the motor nerves take the efferent signals away the central nervous system. In the central nervous system, we have a brain and spinal cord. In the brain, we have cerebrum, brainstem, and the encephalon. In the encephalon, we have hypothalamus, thalamus, and epithalamus. Friends, in the brainstem, we have two parties or regions of brainstem: midbrain, pons, and medulla oblongata. Friends, most of our time today, we are going to focus much time on medulla oblongata. Now, what is medulla oblongata? Medulla oblongata, this is the part of brainstem, which controls all unconscious activities of the brain. Example: breathing, heartbeat, digestion, dilatation and contraction of blood vessels, sleep, nausea, and vomiting. You see, nausea and vomiting control mainly takes place in the medulla oblongata. Yeah, this is the anatomy of vomiting center and the chemoreceptor trigger. So this is the diagram. We have integrative vomiting center here. Here we have medulla oblongata. Here we have pons. Here we have fourth ventricle near the obex. Here we have chemoreceptor trigger zone. Here we have area postrema. Here we have nucleus tractus solitarius. Here we have from spinal cord there up, we have what we call reticular formation. What's reticular formation? Reticular formation refers to far-reaching network of neurons extending from spinal cord to thalamus with connection to medulla oblongata, midbrain, pons, and the encephalon. That is all about reticular formation. Now we are going to discuss about those vomiting center one by one. Friends, what's chemoreceptor trigger zone area postrema? This is the part of brain. This is the part of brain or the area of medulla oblongata that receives sensory input from different body parts and communicates with vomiting center to initiate vomiting reflex. That's one. Second, chemoreceptor trigger zone can be defined also as one of the 7 circumventricular organs, which are the unique structures or areas of the brain that lie outside of the brain barrier, blood-brain barrier. This center of vomiting is located in medullary, as you have seen, medullary reticular formation in the brain, in the area called area postrema. Even though most of the time we use these 2 words, area postrema, chemoreceptor trigger zones, interchangeably. This area postrema is located on the floor or 4th cavity in the ventricular system in the rostral party of medulla. 1. Second, we can say that it's located also on the floor or 4 ventricle before the obex. Friends, very interesting. What is obex? Obex, it is the point in the brainstem where 4th ventricle or medulla oblongata opens to central canal. This region, as you have seen, is situated in medullary reticular formation in the brain. This region exposes area postrema to more saturating substances in the blood and the cerebrospinal fluid. For example, toxins, hormones, all those blood-borne substances elicitate chemoreceptor trigger zone. This receptor, to have the role of vomiting center, place, it needs the essential receptors. We have serotonin, 5-hydroxytryptamine 3, dopamine 2, histamine 1, muscarinic and cannabinoid receptors. There are several triggers that initiate vomiting reflex through stimulation of chemoreceptor trigger zone. Among those, you have metabolic abnormalities, uremia, endocrine causes, especially during pregnancy, toxins, and drugs, especially opioids and the chemotherapy. Others, of course, motion sickness. Second, let us talk on integrative vomiting center. integrative vomiting center. It is the lesion of brain in the medulla oblongata which receives the sensory impulses from different body parts and produce or transmit the afferent impulses to GIT to initiate the mechanical activity of the actual act of vomiting. Once it is stimulated by higher brain center cerebrum such as emotional factors, fear, pain, offensive sight and smell, taste, memory, anticipation, and intracranial pressure disturbance. Of course, hemorrhage and hypoxia, it is stimulated. Integrative vomiting center also responds to stimuli such as peritoneal irritation and other visceral disorders such as inflammation, distension, ischemia, intestinal obstruction, gastric status, and cardiac pain via nucleus tractus solitarius. These are the diagram that gives the summary of vomiting triggers. Friends, we have seen hypoxia. Very important. Why do we usually fear when our patient under surgical procedure is rapidly desaturating? Hypoxia, it is low partial pressure of oxygen in the arterial blood. Once it is low, it enables chemoreceptor trigger zone to be stimulated, to mean that chemoreceptor trigger zone area postrema is very sensitive to hypoxia, to mean that when your patient is hypoxic, be ready that after few seconds is going to vomit. Please let us all prevent and make our patient hypoxia free so that they cannot be exposed to vomiting. That's one. Second, motion sickness. Friends, remember, in the inner, in the vestibular system, there are hairs that have receptor called lambretin, which controls the balance and perception of movement. When you are in a rapid moving car, these receptors are stimulated via histamine and acetylcholine. The sensory impulses goes to central nervous system along vestibular cochlear nerve and through cerebellum there is stimulation of integrative vomiting center and then vomiting reflex. That is all about motion sickness and vomiting. We have uremia. This is the metabolic abnormalities. Once we have higher concentration of urine in the blood, we have also stimulation of chemoreceptor trigger zone. That's second. Third. Fourth, we have pregnancy. Of course, during pregnancy, we have much endocrinal changes where we have a higher level of progesterone and estrogen in the blood. Remember, those hormones relaxes blood vessels to cause something like hypotension. This will expose the pregnant woman to nausea and or vomiting, especially in the first trimester of pregnancy, which can be exacerbated with other things to reach on the level of having severe form of nausea and vomiting, which is hyperemesis gravidarum. Pay attention. Once it becomes severe, you will need pharmacological treatment to attenuate those conditions. We have also drugs. In drugs, we have what we call cytotoxic agents or chemotherapeutic drugs. They stimulate serotonin receptor by 5-hydroxytriptamine 3 and then induce nausea and vomiting via stimulating chemoreceptor trigazone. Opioid is another drug. For example, apomorphine, morphine, epetidine, codeine, and tramadol can cause nausea and vomiting through stimulation of chemoreceptor trigazone. We have also psychogenic stimuli. Of course, higher brain centers. We have psychogenic stimuli such as offensive sight, smell. We have seen higher levels of stress and anxiety. All those stimulate integrative vomiting center and then vomiting reflex. There is also what we call GIT pathologies. GIT pathologies. GIT pathologies. Those GIT pathologies, such as gastric outlet obstruction, emetics such as ipecac, toxins, small bowel obstruction, viral gastroenteritis, stimulate both chemoreceptor trigazone and nitrous tractus solitarius. In addition, we have also cardiac glycosides. For example, digoxin can also stimulate chemoreceptor trigazone and then cause vomiting. Friends, as you have seen, don't think that when your chemoreceptor trigazone is damaged, you are not going to have vomiting, because you have another center which works with vomiting independently without stimulating chemoreceptor trigazone, so to stimulate IVSC, which is nitrous tractus solitarius. Friends, before going to a prepitant, you have to remember that nitrous tractus solitarius, it's the type of nucleus that is found in the medulla near chemoreceptor trigazone to relay sensory impulses directly to integrative vomiting center without stimulation of chemoreceptor trigazone. It holds some receptors that enables it to induce vomiting. Some of them have 5-hydroxytriptamine 3, dopamine 2, histamine 1, and cannabinoid receptors. It stimulates IVC via it is stimulated via vagus nerve and pharynx via glossopharyngeal nerve, especially during gag reflex. Friends, what is a prepitant? Remember, we have seen that there is neurokinin 1 receptor, which are the slow excitatory neurotransmitters called substance P. And these drugs are used together with corticosteroids, especially dexamethasone, to prevent nausea and vomiting induced by chemotherapeutics or cancer drugs. Friends, all those things you have seen, it's all about the physiology of vomiting and nausea and the vomiting triggers. Now we are coming to the vomiting reflex, which is the act accomplished with integrative vomiting center in the medulla oblongata. As you have seen, there are different sources of sensory signals to stimulate integrative vomiting center to have vomiting reflex. Now, after having those sensory noxious impulses to integrative vomiting center, the afferent stimuli is going to GIT from integrative vomiting center to initiate mechanical act of vomiting. It's what we call vomiting reflex. Vomiting reflex, it's also referred to set of efferent signals from integrative vomiting center to GIT to accomplish the desire to vomit. As you know, the vomiting reflex is mediated by both autonomic and somatic systems, and it consists of two phases: prodromal phase and dejection phase.